Good afternoon, everyone. Today we have Mrs. Stephanie Todd, and she's going to be speaking to us about speech therapy, speech pathology, and what that entails. What has her education look like? Any additional certifications she's obtained along the way? What are some highs and some lows within her career? As well as how has COVID-19 impacted her daily work routine? We want to ask that you please mute all lines. If you have any comments or questions, please feel free to put them in the chat box and we'll address them at that time. Once again, thank you all for attending and thank you, Mrs. Todd, for participating.
Thank you for having me. My name is Stephanie Todd. I am currently a SEED speech language pathologist. When I say SEED, there's 3 C's behind my name. So to say Stephanie Todd, MS, which is Master's of Science degree, comma, CCC-SLP. The CCC is when I attained my master's and took a national test, and it means Certificate of Clinical Competence, and then dash speech language pathologist. So to start with my journey, I wasn't one of those people who grew up and knew exactly what she wanted to do. I didn't. So I do have a couple of degrees behind me. I started off with getting a bachelor's degree at University of Houston, Victoria in psychology. And so me and a friend were graduating. We have our psychology bachelor's degree. And we got that degree because a psychology bachelor's degree can morph into many master's programs. You know, it can go into the law program. It can go into the medical field. It can go into education. It was like a general, like a safe key, if you will, and it can go into counseling. But because we didn't know which way we wanted to go, it was a good bachelor's degree that we can use to go to the next step. So got our bachelor's degree in psychology, and we're like, now what? So looked around Victoria. We could have worked for Gulf Bend, or we could have worked for the school district being special ed teachers. We were young. We looked at the money, looked at who paid more, who allowed us to work less days, and for us that was a school district because it's not year round. We would have our summers off and all that good stuff. So we went and we got our teaching certificate to teach special education through Region 3. So I was a special ed teacher for 5 years. I taught 8th grade inclusion, meaning that I had kids who had deficits as far as maybe in their learning, or maybe their reading, their math, their writing, and they were in a regular ed classroom. So I would go in there to help them, but not to pinpoint them out. I helped everyone in the classroom. So as far as the kids and they were concerned, they thought I was a teacher's aide, not knowing that I really was a teacher, but I wasn't going to point out my special ed kids saying, no, I'm here for him, here for her. I didn't do that. I just helped everyone. But I mainly made sure that my special ed babies, if they needed extra time, if they needed me to read something for them because they were auditory learners, that was my job, to make sure they got what they need in the regular ed setting and not have to be in a special ed classroom. So I did that for 5 years. And I started getting antsy. I started thinking, okay, there's more that I can do, more that I want to do. And so again, me and that friend who got our psychology degree together, we thought, let's do counseling. We always wanted to be in the position to help people. So that's where my career has always taken me. As long as I can help people, I'm good. So we went back and got our master's at University of Houston, Victoria in counseling. And with that degree, it allowed, and we took the state test, which allowed us to be school counselors. If I wanted to go further with that, I could have and went back for an LPC, which is licensed professional counselor, where you could work for Gulf Bend. You can work for many different agencies, whether you're counseling kids, whether you're going into nursing home and counseling the adults who are depressed because they've lost loved ones, or they're in a nursing home and no longer around their family or no longer in their homes. Counselors are very much needed. But I wasn't willing to go put in the hours I needed to be in LPC. You had to do, 3,000 hours, which really isn't much now. But to me, back then I was young, I was impatient. I didn't want to do it. But that was an option. So I did school counseling for 3 years. But while I was doing school counseling, again, I've never been the one to know what I want to do when I grow up. I decided that, okay, I want something that I can do in education as well as outside of education. The school counseling, I can only do that in the school. But I couldn't necessarily do that outside the school unless I went back for an LPC. And I thought, I don't think I want to do that. So I heard about the speech language pathology program that Texas Women's University, which is located in Denton, Texas, up by Dallas. They were offering the speech program, but they were offering it through the different region centers in Texas. I don't know if you know this, but Texas is sectioned off where so many counties are under a region. So Victoria's under Region 3, along with Etna, Goliad, Refugio, just different counties under certain regions. So they were offering this program through the state via the region centers. And what would happen is if you applied and you got accepted, you would, at that time, you go to the region center twice a week. And just like I'm talking to you, we'd be there looking at a screen and the professors would be talking to us, and we'd be there for 4 hours, from 4 to 8 o'clock, Tuesday and Thursday. The other days of the week, we had to do the work ourselves at home and this and that and the other. But all tests and all lectures were done at the region center. So I thought, well, I'm going to apply. If it's meant to be, I'll get in. If not, I'm not going to be upset about it because I already have a master's in counseling. So going to be okay. But lo and behold, I did get in. I didn't think I was going to get in. I thought, well, they're not going to let me in. I already have a master's. There's people who don't have a master's who they want to give a chance to. You know, I don't have a speech background as far as, you know, teaching language to that level. But I did get in. So I got into the speech program. And it was through Texas Women's University, and it was 3 years. And it was 3 years because I had a semester where I had to do leveling classes. When I say leveling, yes, I already had a bachelor's degree in psychology. I already had a master's in counseling, but I didn't have 4 to 5 speech language classes that were needed to pursue this master's. So I had to do those classes first, which they offered, as well as I had to do 25 hours of observation, meaning that I had to go to different facilities to see what a speech therapist does and take note and write that down so they can say they didn't want us to get into a program and not know what it was about. So in order for them to ensure that we knew what we were getting into, not just by reading it from Google or hearing it from friends, we would actually meet people, see people, I didn't know who they were, and we would follow them around, whether they worked in nursing homes, whether they worked in the hospital, whether they worked at rehabs like Warm Springs, now it's called PAM, Post-Acute Medical, where they did home health, where they went to different people's homes. We had to follow them and log in 25 hours to see what all could be done. And because I did mine during the summer, I couldn't go to a school system and see what they did in the school. But I already knew because I was working as a school counselor and I would see the speech therapist there. So I knew what they did in the school. So I was happy to see what they could do outside the school. And that's one of the beauties about being a speech language pathologist with your C's is that you can work in the school district, any school setting. You can also work in the medical setting, and that could be hospital, that could be nursing home, that can be home health, and home health can include geriatric, meaning 21 years old and older, or pediatric, which is from birth up until the age of 21. So if you have a preference where you want to just do babies, you can do babies. If you have a preference and you love your older people, then you can do that. I love all of it. I have to admit, I do love all of it. And so I like that. That was what I thought, this is what I want. I want to be able to not only work in education, but I want to be able to work in the medical field. And I also found out with my C's that I can have my own practice. I don't have to have a doctorate to have my own practice. So if I wanted to have just a speech clinic, if you will, this was just me, and have patients come and see me one at a time, I can do that. So it's very versatile, and I like that. So I did this degree. I had to take a test at the end. As you will learn, most occupations now require you to take a test. So I had to take a state test to get my state license. And that was a very simple test. Now, of course, you had to pay for it. The one that was the big test was getting my C's, and that's a national test. I can live anywhere in the world and practice my field. I just have to take, well, some states you take a test, some states you just pay a fee and you get a license. So if I move from Texas and move to New York, then all I would have to do is submit my documentation showing that I am a speech therapist, and I'd have to pay a fee, and then they would issue me a license for that state, and I can do what I'm doing now here in Texas. If I moved to Hawaii, the exact same thing. Out of all the states in the United States, California takes the longest. Anywhere else I can submit and get it done in less than a month. California has been known to take up to 6 months before they finally turn around and say, yes, here you go. We acknowledge your documentation, your body of work. You're now, certified to work in the state. So the C's was the main thing. That was what I wanted to do, where I could practice on my own, where I could eventually supervise assistants. And so that was the goal, and I was able to achieve that. And so I've been a speech therapist now since 2008. And I've worked for the school district for all these years. However, starting 2009, I wanted to give myself a break. So I finished everything in 2008, and I was working for Victoria Independent School District, and that was my first year. And I wanted to get my feet wet and everything that comes with that. Now, what comes with that in the school is that you will have a number of students who need your services, whether they need your service for articulation, being how they say their words, or whether they need your assistance for language, maybe they aren't saying words, or maybe when they try to say words, the sentences, they're incomplete sentences. We also cover voice. If there's anything with the voice and there's crackly, and it's not like your allergies, it's like a doctor proven that there is a voice disorder, we do cover that. If you have disfluency, meaning that you stutter, that is our area. We also cover swallowing. So for those patients or students who have trouble biting their food, first and foremost, maybe the food's too hard, maybe it needs to be a soft consistency, and then the size of the bite that they do, then can you chew it properly, and then are you chewing it enough and then swallowing, or are you taking a bite, doing 2 chews and swallowing it, which isn't good? Or are you holding it and not swallowing it? Or is it getting stuck here? That's all on us. So we cover a lot. We cover cognition. Not so much cognition in the school, but in the medical field, yes. So if you have a patient who had a stroke and their memory is impaired, that is us. If they can't tell you where they are, who they are, they're orientated. They're not orientated to who they are, to where they are, to what the date is. That's on us. I have had patients who I would go in and say, okay, what year are we in? They'll say, well, it's 1965, and it's not. Or I'll say, well, who's the current president? And they'll say, well, it's Roosevelt, and it's not. So you learn where they're at cognitively and where you need to build on that. But before I get into the medical field of it, I'm gonna go back to education. But in all areas, you cover all those things. That's our area. So I'm gonna start with articulation. With articulation, we look at how you say the word and how you say the sounds in that word across the word. For example, P. I'm gonna listen for P at the initial part of the word, meaning pot. Can you say pot? Then I'm gonna listen for P in the middle of the word, like carpet. Can you put the P there? And then I'm listening for P at the end of the word. Can you say cup? Some kids will say cup and leave off the P. Or even if they say carpet, it's quiet. You can't catch the P. So we listen for sounds across the words. And in districts, we go by this. This is an indicator of where you should be at a certain age. So by the end of your 3rd birthday, you should have your P, your M, your W, your H, and your N. So by the end of your 3rd birthday, before you hit 4, you should have these sounds across any given word. When you're 4, you should have not only these sounds, but you should have the G, the K, the F, the B, and the D by the end of your 4th birthday. And so you just keep going on and on. I will tell you from experience, the hardest sound for kids to make is the R sound. It comes out in a W, or it'll come out, like instead of saying bear, their vocalic R would be bear or call, or instead of saying rabbit, wabbit, walk and woll. So R is the hardest one, and a lot of parents think that their child is 5, and why aren't they saying it? Because they have friends, kids who are saying that sound already. Everyone develops differently. So for education, we have to give the child time to develop. So that's why this chart was developed and used in the school district. So in TEA Backsit, where you come in and you're 5 and you can't say R, where parents may not be happy with it, but in education-wise, you're fine. You're where you need to be. That sound will come. You have to the end of your 8th birthday. However, if that child went to a medical facility outside of education, like a clinic, their clinic does not have this kind of chart. They don't go by this because it's medical. With medical, if there's an issue, then it's an issue no matter what the age is. So if they go to a clinic and the clinic gives them some kind of articulation test and they miss all these R's and they're 5 years old, there's a good chance that clinic's gonna start working on that R, and they can do that. But us in education under TEA, Texas Education Association, I can't make a kindergarten say R and say that it's wrong. I have to say, yes, they're not saying R, but they do have time to develop, and we have to allow them that time. You don't put a kindergartner in 3rd grade because they did good in kindergarten. Does that make sense? There's steps to get there in education. In the medical field, they don't have to worry about those steps. But in education, you do. That's the whole point, is growth. You have to have time to grow before you get to the next step. So we use this in education. We listen for those sounds and words first. And then if you can do it in words, then we go for, can you do it in a phrase? And then we do, can you do a full sentence? And then we look for conversation. And even if the child can do these things with us in the therapy setting, I listen, can you do it outside? Because so many kids know that, okay, well, I'm with Miss Toss, I gotta say it right. But then as soon as they leave me and I hear them down the hallway, it's like they never were in speech at all. So always talk to the parent, always talk to the teacher to see, is it generalizing? Is it carrying over from speech therapy to other settings? That's the whole point. Stuttering, that can be dealt with, that can be based off of emotion and stress, so you have to watch where it's coming from. I have kids who have had with me in therapy and didn't stutter at all. But I go to the classroom, as soon as the teacher calls on them, they get nervous, start stuttering. So at that point, I just give the teacher strategies and not necessarily put them in speech therapy, but I'm like, okay, they can do clear speech, but they just get nervous in front of their peers and they're called on, so let's try these strategies. Sometimes a child may start stuttering because there's been a death in the family, or there's been changes at home. Maybe someone passed, maybe mom and dad got divorced. And so the parent may say, well, my child stutters at home all the time. And I'm not saying the parent's lying, the child may, but home is not my jurisdiction. I can't work on home, I can't fix home. I can only work on what happens in the education setting. So if that teacher tells me that the child is stuttering, then I'm on it. If I hear the child stuttering, I'm on it. But if the child does not stutter at school and the teacher doesn't hear it, I don't hear it, but mom is insistent that they stutter, then that means it's something at home that's triggering that child to stutter. And that's when I would refer them to a counselor at that point, not a speech therapist. Another thing people think the speech therapist should be covering is people who are mute, whether you're a child or adult. If you're mute, meaning that you won't talk at all, they automatically think that it's a speech issue, whether they think it's your voice or what have you, and that's not necessarily the case. I've had a couple of kids come to me that they were considered mute, and I tell you what, by the grace of God, they would start talking to me, but they were comfortable. So I realized that it wasn't that they couldn't talk, they didn't want to talk. And our job is to work on things if there is a disability, if there's something prohibiting you physically from talking, whether it's your tongue, putting your tongue in the right placement to make the sound, your lips. But with that, when they're mute and they're not talking, a lot of times that's a psychological thing. There's something going on in their lives that's triggered them to not talk. And again, that will be referred to a counselor, not a speech therapist. But that's in education. So in education, we get referrals that they need speech therapy. We test them. If they say, Stephanie, I think that's an articulation issue, well, I'm going to look at articulation. I'm going to look at your voice, your fluency, your language. I'm going to look at all of it. And so when I write the report, I will address everything saying, yes, it's within normal limits. No, this is not. This qualifies them with the speech impairment articulation, working on this, this, and this. And then we have a meeting, because they can't have speech therapy until we have a meeting. The meeting will consist, called an ARD, admission, review, and dismissal. I'm admitting you into special ed with the speech impairment. Every year by law, we'll come together in a meeting and we'll review how you're doing with your parent there, with the teacher there, with the principal there. And then let's say by the time you're in 2nd grade or 5th grade, you're where you need to be, and I dismiss you from special ed. Just because you have a speech impairment label does not mean that it's with you for life. It's one of those that can be removed. So if a parent wants their child out of speech therapy, all they got to do is call me and say, I want them out, and we'll have a meeting and they'll have them sign a form that's called refusal of services. Once you are in speech therapy and you are tested and you leave Victoria and go to California, it goes with you. California will acknowledge that you are in special ed, but they probably will retest you based on what they use. But because you've been in special ed, you're currently in special ed with speech impairment, they will acknowledge it and provide those services until they have a meeting to say, yes, you need to continue, or no, you don't. So whether you move to California, move to Houston, the testing, the program follows you. Unless your parent says they don't want you in speech therapy, or they don't tell the school about it, they won't know anything about it. So that is education. Medical field. You can also see kids in the medical field, whether you see them at the hospital in the NICU or whether you see them on a home health basis. I have not worked in NICU, but I have worked a hospital. I worked pediatrics home health for about 3 or 4 years, where I did go to kids' homes and I would see them. And I had kids who were on trachs where they couldn't talk and had to be suctioned. My job was to work with their oral motor so they didn't lose that sensation. So just because they couldn't eat, and they may have had a feeding tube in their stomach, feeding tube meaning like a little port to where their medicine things were put through that port to get to their stomach because they couldn't digest anything this way. So my job was to make sure everything here stayed alert. And then we'd work on eventually, working these muscles here to where maybe eventually they won't need that trach anymore. But I wanted to make sure they have sensation on their lips, whether I use ice, whether I use lemon, whether I had my gloves on and I'm massaging their tongue and their cheeks. Because if you don't use your mouth, and if you were born never using your mouth because you were born with some kind of disability or chromosome disorder, then you don't know what all they can do. So that was my job, to introduce you to what these mechanisms can do and to keep them and to strengthen them so that, one day when you do use them, you could. And if I did that enough and work with the child enough and can get them to swallow, then that was great. I would recommend, them going to get tested to make sure that it was a legit swallow, not just a fluke. And the way I would test them would be to give them some dyed applesauce or dyed thickened liquid. When I say dyed, you don't pick red because it looks like blood. You don't pick blue because it looks like if they're blue, their lips turn blue, that maybe they can't be, they're not breathing. So I'd pick a color like maybe green. I talked to the nurse about it. And I would dye the thickened substance and we put it in their mouth with a syringe. And as soon as it goes down, she would get a suction thing to suction out the tube in their stomach, the feeding tube I mentioned. And so I'd give them like one of this much of a liquid. And if she suctioned out that liquid and it's all green, it was as much as I gave them, then we know it went down and didn't go to their lungs. If it doesn't come out their stomach right away, then it went to their lungs, which means they aspirated. That means that it went to their lungs, they aspirated, and if they eat, then they could get pneumonia, and that can cause a whole another trauma, which we don't want. So I would always do trials on my babies to see what they could and couldn't do. I was not going to sit there and start, because the parent wants you to start feeding right away or give them a bottle. I'm like, can't do that. We have to see what they can and can't handle, because if it's not going down to their stomach and it's going to their lungs, and I'm not giving the child pneumonia. So we had that with adults, with kids, as far as the trach. Some kids I had that stuttered. Some kids I had that were just language, had a hard time forming their sentences. I haven't had one that had, I did have one in the school that had a voice issue. He had nodules, which means like here are your vocal folds. He had like knots on his vocal folds. So when he hit it, when you talk, they're moving. The worst thing you can do for your vocal folds is to whisper, believe it or not. So when he talked, they hit and it made it worse. So the doctor recommended that he needed to rest his vocal folds. Well, that meant that this 5-year-old needed to not talk. That's the only way you can rest your vocal folds. But 5-year-old, you know, it's not going to talk. So that was hard for the family and hard for him to do. I don't know how that ended because he moved into my school for maybe a month and then he left and they moved out of town. So I'm not sure how that ended up. But again, that's our area. Geriatrics, home health, I have done that and I'm still currently doing that. I go to homes, I can go to the facilities they're in, whether it's a memory facility, whether it's an assisted living facility. And we work on swallowing because as they get older, these mechanisms become weaker. If they have Parkinson's, it definitely becomes weaker. If they have dementia where they forget, sometimes people with dementia, Alzheimer's forget how to swallow. They forget that they need to swallow, that they need to chew their food. And then their cognition, they forget who they are. They may forget where they are. They may forget if I hold up, you know, these and I say, what are these? They can't tell me that they're glasses. That's my job to do. When I worked in the hospital, that was different. When I say different is hospitals will take the patient in, they have a stroke or whatever, and they'll work on them. But as soon as their vitals are good, those patients they go to a rehab. So sometimes I would have a patient for only a week, and other times if they were able to go to our rehab on the floor, that was DTAR, then I may have them for 4 to 6 weeks. So some patients had strokes and it alters your personality sometimes. They were known as being very happy, and after the stroke, maybe they're crying all the time. And they don't mean to cry, but that's just what they're doing, they're crying. So my job is to, no matter what the setting is, not only work with the patient or student, but to educate their parent or their caregiver of what they need to do and what to expect. Because it can be life altering if you see someone you love not performing how you thought they should be performing, and you don't know what to do and you get scared. So that's also part of my job, is to ensure that, you know, we'll work together. It's going to be fun. There's going to be some ups and downs, but however, as long as we work together and follow the same plan, you know, we will see some progress. Progress may not be fast. Some days it will, some days it won't. They may even regress and then go back again, but that's all a part of the cycle. Trying to think. Virtual. Well, no, yeah, virtual. Teletherapy is now being done because of COVID. However, it was done way before COVID. Teletherapy with speech therapy has been in play for probably 10 years. And that's because there's areas in the United States that are rural and they couldn't get people like me to go live there, but they had kids in the schools who needed people like me. They needed speech therapists. So their way was to have teletherapy where someone like me would be on the camera like I'm talking to you and talk to them and work with them on speech therapy. It is utilized now even more so because of COVID. Also because of COVID, when I do go see patients, I am geared up more than what I normally do. So when I go see patients now, I have a mask on at all times. I have my gloves on at all times. I used to always, and I still do, I used to always just call my patients the day before and then call them the day of to make sure we're still on for me coming over. And now it's mandatory with who I work for that we called it and asked like 7 questions, such as, you know, how are you feeling? Do you have a temperature? Have you feel nauseated? Have you had any body aches? Just a little protocol I have to go through to make sure that they're not developing symptoms that could be COVID related. Because if it is, then I report it to the nurse, and then they go from there. And then I wouldn't go into that home. I do take their temperature, but I've taken their temperature every time before COVID. But now it's definitely take their temperature. If I go into any facility around here in Victoria, most of them aren't letting us in, except for one. And they take my temperature, and if it's a high temperature, I won't be able to see the patient. If the temperature's normal, I'm able to sign in and go see my patient. let's see. I guess it's tricky with COVID because, they say cough, this and that, but sometimes I cough and I sneeze, but I have seasonal allergies. So you don't want to be in a mad panic, and you don't want to, stress people out. So when I do go into people's homes, I don't talk about anything on TV. You don't want to stress anybody out. Even if I did pediatrics and school things, I'm not there to talk politics. I'm not there to talk about what's going on with this, that, and the other. I'm there to tend to you, your needs, your medical needs, and that's it. Trying to think. And because I am still on the path of discovering what all I can do and what all I want to do in life, I started pursuing a third master's in January of last year. I just finished about 2 weeks ago with the master's in business, so an MBA. And you're saying, oh my gosh, how many masters is she going to get? Well, that's a good question. And I'm hoping that this was the last one. But I did this because I want to do more than be on the front lines of rendering services. Like right now, I'm a speech therapist, or if I want to be fancy, speech language pathologist. Some people are picky about the title you give them. I'm fine with either one of them. And right now, I'm on the front lines. But eventually, I don't want to be on the front lines rendering the service. I want to be behind the scenes working that aspect to help out patients and to help out fellow speech therapists. So I went ahead and got my MBA in business, and I didn't make it health related. I just wanted to be, I want to be general. I didn't want to pigeonhole myself in anything. I mean, yes, my background is in education. I've also worked medical since 2009. So I just didn't want to pigeonhole myself into what possibilities there were. So I just got a master's in business association. And when I say pigeonhole, I could have got a concentration in health administration. I could have got a concentration in finance. I could have got a concentration in accounting, data analysis, but I didn't want to do that. With my C's and my background in education and background in medical, I could be at a nursing home and be director of therapy, which means I could be over physical therapy, occupational therapy, and speech therapy in a nursing home. Just with my C's, I can do that. Now, I can't run the nursing home because the nursing home, they want you to have a health administration degree, and you take a test to be a health administrator. But you can do that. As far as salary with speech therapists in the schools, it can range from, I'm going to say, $65,000 a year up to about $85,000 a year, depending on experience. In the medical field, it can range from mid 80,000 up to six figures, past 100,000. And that's here in Victoria. So there's definitely opportunities. I supervise right now because I have my C's. I have an assistant, and she does most of the therapy with the kids. She sees probably 3/4 of them. I still love seeing my babies, so I see 1/4 of them. And so with her, I have to give her 2 hours of supervision a week, 1 hour direct where I'm right there with her and I'm watching her, and the other hour indirect. So whether we're just talking about different kids, I'm going over the testing I did with kids, comparing that to what she learned, what she got from them in a session. And we've been doing that via teletherapy too. So I'll sit on her sessions with kids, and then after the session's over, maybe me and her like this talking for a good while throughout the day. And that was another thing why I love the speech degree, is that I'm thinking, okay, when I'm 60 years old and I don't want to work anymore full time, then maybe I can contract myself out to be a supervisor. So if there's a district who needs a supervisor to come watch 3 assistants and pay me for maybe only 20 hours a week, I can do that. Or if I need to be an assistant to someone in the medical field and with my background, I could do that too. So that was one of the reasons why I wanted this degree too, because besides the options of education medical, as I got older, there were still options I can do and not have to put in a full 40-hour week to make a good living. I could have retirement and I could have that. And And like I said, with this new master's of my MBA, Master in Business, I'm looking at getting out of the front lines from providing the services to being behind the scenes and implementing different policies, maybe strategies. It's a different aspect of it. But as long as I'm helping people, I'm good. I'm good. Trying to think if there's anything that I missed. I wanted to show you this. Whether you're working with kids in school, I don't know if you can see this, or adults who can't talk, this is a device. And this is an iPad, but the app is called LAMP, Words for Life. And so this assists kids in talking who can't talk. So maybe they're mentally okay, but they can't play it out here. If they tell me they want to eat, or that they're hungry, they can go to Apple and say fruit, banana. And it said banana. I don't know if you heard that. Or if I want them to say a sentence, and you have to learn what the keys are. So I can say, I want banana. I want banana. I want banana. Now, this is not as easy as it looked, only because before I put a child on this, I have to see, can they access with their limbs? Because as you see, I just made one sentence and not even a complete one. But I want banana, 3 words, but it took me 6 hits to get that 3 words. So do they have the stamina to hit those buttons to make a simple sentence? You can also do this via eye gaze. For those kids who have cerebral palsy and they can't move, they don't have much control of their limbs, there's an eye gaze where they can look, like I'm looking at you in the camera, they can look and they can look at the screen and it will say what it is they want to say for them using their eyes. But again, you have to make sure does that child have good head control? If their head's doing this a lot, then they're not going to be able to do the eye gaze. So when I have children like that and I'm looking at trying to get them to communicate, I'm also with my occupational therapist who works with fine motor, pretty much waisting up. You're dressing, you're buttoning, you're zipping your jacket, you're buttoning your shirt, or all that good stuff. That you writing your name, how you hold your pencil. That's occupational therapist. And so I would always get with them and say, okay, I'm working with Stephanie and I can't find the point where she can access this device. Yes, Stephanie can put her hand on this button, but she doesn't release it right away. So once she puts her hand on it, it stays stuck. I need to find some kind of limb on her that she can not only press the button, but she can quickly release. And so my occupational therapist will work with the child and say, okay, Stephanie, I think that she needs to have the button by her head because she has more control to hit it with her head. Or she's better with her pinky finger on this hand. So it's a lot to look into when you look at an assistive technology device. There's low tech and there's high tech. What I just showed you was high tech. That's if they can do it mentally, if they can have some kind of limb where they can work the machine, that's high tech. Low tech is pictures. So if I show you have a picture schedule where now is snack time, now is restroom time, now is nap time, now is playground time, can you go over there and pull what I tell you to pull? If I say, okay, go over there and pull, snack time, where it's snack time, and you go to the picture schedule that I have and you pull it off the Velcro. That's low tech. Or if I say, okay, what do you want for snack? Here is your binder with the Velcro of different snacks. What snack do you want? Pull the snack. Do you understand what I'm asking of you? That's receptive language. And then will you respond by choosing the proper one? If you don't know what snack is, you're not going to choose a proper one. So again, that's my area. I got to teach you familiar things. I got to teach you categories. You have to know if you want a banana, banana's fruit. When you're using this device, everything's in a category. So I got to know, do you know categories? If you don't, I got to teach it. Do you know snacks? If you don't, I got to teach it. So there's a lot in our area. I can go on and on, but I won't. I will let you ask me any questions you may have.
Does anyone on the call have any questions they'd like to ask Ms. Todd at this time? Please feel free to put it in the chat box. With no additional questions, no further comments, we want to appreciate you, Ms. Todd. You shared a lot of wealthy, valuable information, and we appreciate you sharing everything in such great detail. We can't thank you enough. If you do
Thank
find
you.
yourself having any questions at a later date and time, please feel free to email us and we can connect you with her. Once again, thank you all for joining us, and thank you all for participating, and thank you, Ms. Todd, for everything you've shared.
Thank you. I appreciate it. And I hope I didn't confuse anybody because it is a lot, but it's fun. It's a fun occupation.
Yes, ma'am. Well, like I said, please feel free to email us so we can connect y'all too. Once again, you all stay safe, stay healthy, and you'll have a good afternoon.
Thank you.